I'm going to talk about a few things here related to the results of the election, the continuing response to COVID, the economic stimulus packages, what I see over the horizon related to assuming that Joe Biden is going to be our president on January 20th, some implications of policy proposals that he has discussed over the last year related to mental health policy and healthcare policy. Next slide. Just briefly, I was going to mention that in regard to our Medicare Provider Recognition Bill, the Mental Health Access Improvement Act, our lead co-sponsors, Representative Thompson from California, Representative Katko, were both reelected. They've been our lead, co-sponsors on HR 945, for the last few years, and have really done a splendid job of navigating, especially this past year, getting our bill passed in the House Energy and Commerce Committee. And based on my kind of brief tally of looking at, we have 120 sponsors of our bill in the House, that the vast majority of all of those sponsors were reelected. Our lead sponsors in the Senate, Senator Barrasso from Wyoming, Senator Stabenow from Michigan, were not up for reelection. So that's all status quo. I do expect there may be some reorganizations and some key health committees in the House. That may be good, that may be indifferent in terms of our bill, as long as we have our key co-sponsors and other sponsors of our bill. We are hoping that the bill will be introduced from the get-go in early January when Congress reconvenes. We know the Senate is up in the air, due to the special elections that will be coming up in early January in Georgia, but currently it looks like the Republicans hold a 50-48 lead. I'm not sure what the implications will be related to our Medicare bill, but as long as Barrasso and Stabenow are pushing our bill, that's the good news, and maybe we'll be able to get some new sponsors of our bill, but we are not going to know the composition of the Senate for another 2 months. Next slide. Some things are going to be coming up, pretty quickly here. Is that there will be continued COVID-19 economic stimulus negotiations that are going to proceed, although there's still a lot of uncertainty. And we know the Biden team already is poised to begin engaging legislators on the Hill and the things that they would like to do related to economic stimulus to address the COVID-19 pandemic. And they're already kind of mapping out a strategy, during this, what may be a kind of a tumultuous lame duck session, with the aim of getting money lined up for their priorities, before the end of the year. Of course, Biden's team would not be in place until late January, but I think we're going to see a lot of activity behind the scenes. And while all that is going on, we may be facing a government shutdown, deadline. Next slide. And that deadline is that we're operating under a continuing resolution to keep the federal government open. I'll talk about that in a moment. But in the meantime, we still have kind of the aftermath of the election in terms of counting votes in some of the key battleground states, as you know, in Pennsylvania, Nevada, although those states have been called. But we know there'll be some recounts, it looks like, in some states, like Georgia, potentially Arizona, as well as Wisconsin. We know that the Trump campaign has been talking about, several, legal battles, legal cases that they're going to take up in Pennsylvania, other states, with potentially their goal is to get all this up to the Supreme Court. And, there are concerns about quote unquote fraud or fraudulent activities. So although the election has been called, as you all know, unless you've been hiding the last couple of weeks here, that the Trump campaign is going to continue to fight. It looks like the findings in several battleground states, and although the election has been called by all the major news services, in terms of electoral college electors, as you know, state constitutions, kind of are very explicit that the vote in that state, those counts whoever wins the election in terms of the public, count, those electoral college electors are binded by voting in their state legislators for the outcome of the election, whoever won, whether it's Democrats or Republicans. But that whole process will play out over the next 5 weeks when those electors basically, vote formally in a way, not only in their state legislators, but, before the House of Representatives. We don't expect that there'll be any major problems or things that will happen with those state legislators, since they have to faithfully vote according to the vote in that state. But there may be obviously a tumultuous period here in terms of the transition that I'm sure you've been all hearing about, where the Trump administration at this time has not given the go-ahead to the government services agency to allow financing and funding for the transition, and setting up space here in Washington for the Biden team to begin the work of transitioning over the next couple of months. And this is all going to be going on again during these Georgia Senate races. Next slide. But before we look ahead, as I mentioned before, we're going to be in a lame duck congressional session here, for the next several weeks, probably leading all the way up to, late December. The 2020-21 federal budget still must be approved. We're operating under what's called a continuing resolution to keep the federal government open until December 11th. And I'm anticipating we're probably going to see another short-term continuing resolution developed in early December. Once that CR is scheduled to expire, I'm not sure they want to play a whole lot of games, and how bad that would look if there was a shutdown at this point, given everything else that's going on. Next slide. There's always this parlor game when there's an election on appointments, to the cabinet and other key agencies. So the early test of the Biden administration, kind of on healthcare issues and mental health policy issues, will come with certain appointments that I did want to highlight. We'll have a waiting game for the Secretary of Health and Human Services. There's, some scuttlebutt that the Secretary of HHS could be a former Surgeon General under President Obama, Vivek Murthy, who was the Surgeon General for several years in that administration. And there's also rumblings that the current New Mexico governor, Michelle Grisham, may be in the running for Secretary of HHS. And we know there's obviously many key agencies that we track very closely, like the Substance Abuse and Mental Health Services Administration, HRSA, CMS, where again, there's some potential names being floated about related to the Center for Medicare and Medicaid Services, CDC, FDA, Surgeon General. Next slide. As well as the Veterans Administration, seems to be a lot of rumblings that maybe Pete Buttigieg is in line to be the next Secretary of the Veterans Health Administration. And of course, the other positions that will need to be filled. Next slide. There's no question that the first major policy area kind of out of the box here is related to the Affordable Care Act. And as you know, there's really key provisions in that bill, in the Affordable Care Act that's been in place now for 10 years, which includes mandatory mental health, substance abuse benefits as essential health benefits, federal parity, protections to see that those benefits are comparable to medical care, preventive screenings, including depressive screenings, and that people cannot be charged or denied coverage for pre-existing conditions, which of course include, mental health conditions. So next slide. So, so where does President-elect Biden stand on some key healthcare issues that I'm just going to highlight for a few minutes? Next slide. Obviously, as you know, his proposals on COVID-19 and the pandemic. He's talked about on time and time again that he's going to put public health leaders, front and center in communication about the pandemic. He's going to give the federal government the primary responsibility for the response, expanding, relief to people to eliminate out-of-pocket costs for their treatments related to COVID-19, increasing Medicaid, federal matches, expanding unemployment insurance, providing, subsidies, reopening enrollment for uninsured people, as well as reversing the decision to withdraw from the World Health Organization. Next slide. And we also expect, that the president-elect is going to unwind probably a whole slew of the current administration's healthcare policy, reversals through regulatory actions and executive orders, which will probably be the main avenue. Biden is likely to bring a lot of Obama alumni back to help steer his healthcare policy area. And whoever is on the Biden healthcare team will probably be, champions of the continuation and the expansion of the Affordable Care Act. Next slide. So as I mentioned, out of the gate first will be these provisions that I mentioned related to the Affordable Care Act that Biden is going to want to protect. Next slide. Today, the Supreme Court took up, the case where several attorney generals in 18 states are pushing to invalidate the Affordable Care Act in the case being called Texas versus the U.S. And the position of those attorney generals is that the law should be unconstitutional because the individual mandate penalty has been eliminated. And oral arguments were heard in Supreme Court today. But we know how important I think this law is for people with mental health conditions. As I've explained, the ACA's provisions require insurers to cover behavioral health, treatment, and a ruling against the law could, dramatically reduce access to services. And particularly if the law was struck down, these actions would also undermine, mental health parity. Next slide. And as related to the Affordable Care Act, Biden wants to expand financial assistance for people with incomes over a certain federal poverty level, people with employer insurance to be able to buy into the Affordable Care Act, and adults that have not expanded Medicaid. He wants to make those tax credits that people use to buy insurance on the health insurance exchanges, more affordable. And he wants to restore funding to a lot of outreach and assistance to inform people about their options that occurred under the Trump administration. Next slide. He also wants to include, as part of the Affordable Care Act, a public option, kind of like Medicare, that people can buy into, in addition to the health insurance exchanges and the federal marketplace, which would include the ACA's health, essential health benefits, and the ability to negotiate with hospitals to try to lower costs. But Biden does not support a Medicare for all that would replace all insurance options. He would just like to provide an option that people could buy into a federal kind of program, maybe a la like Medicare, but it's not mandatory. Next slide. And on Medicaid, which obviously we're very interested in because many people with mental health conditions have Medicaid coverage, that he wants to retain, the Medicaid expansion. He wants to allow states that have expanded, Medicaid to have enrollees enroll into the public option, and provide more for federal support for the program, as long as the economic crisis due to the COVID-19 pandemic persists. Next slide. I'm just going to go through these pretty quickly. Be glad to answer any questions, but Biden also has some proposals on lowering healthcare costs, but they're mainly about slowing down the rate of increase in health insurance premiums for employer coverage, for insurance coverage, and supporting prohibitions against any surprise medical bills. Next slide. He also wants to use the federal government to lower, next slide please, to to lower prescription drug costs, cap, out-of-pocket drug costs in Medicare Part D. He wants to allow importation of prescription drugs that are developed in other countries. Next slide. He also has several proposals related to HIV policy. Next slide. Several policies related to immigration and health coverage, including reinstating DACA and making it easier for people to citizenship. He would like to eliminate resources toward building the wall, and he wants to reverse Trump policies that separate parents and children at the border. Next slide. He's also outlined several proposals related to long-term care and providing tax credits to caregivers who provide assisted living and long-term care services. Next, he also has outlined a Build Back Better agenda to address racial equality that I've outlined on these two slides. Next slide. And I just want to summarize a couple of key things. Next slide. Next slide. Biden's proposals on mental health policy that I have heard in the debates over the last year, they're on a website, kind of come down to these kind of major things. He's talked about releasing a 5-point plan to address, he's committed to protecting and building on the ACA to encourage coverage expansion, protect mental health services, redoubling efforts to enforce mental health parity laws, and ensure access to health providers. Specifically, he's called for investing in training and hiring more mental health clinicians, including mental health counselors, peer support specialists, while increasing training for health professionals and educators. So very promising. Next slide. He's also released a 5-point plan to address the opioid crisis, as well as voicing support for exploring incarceration alternatives to those with mental health disorders. Next slide. And he's also really drilling down, outlined a lot of specific policy proposals related to suicide prevention, the mental health workforce, mental health parity, opioid addiction. Next slide. And again, I wanted to highlight on the next slide in terms of mental health workforce activities, that as part of this education plan and built into that plan, he really wants to double down and expand dramatically the number of psychologists, mental health counselors, other mental health professionals across the board, including those working in grammar schools, high schools, and so on, and wants to increase funding for the National Health Service Corps. Next slide. I'm going to skip over, Rebecca, sorry, to a couple of slides that say other mental health related policy issues. Biden has also talked about ending current practices of long-term detention, separating families, workplace immigration raids. He's also supports stronger gun control, including universal background checks and a ban on assault weapons. I do want to highlight, while this is all going on, we know there's going to be a major crunch at the state level due to the pandemic and the loss of tax revenue. The next slide. And we know that there's going to be a major hit to those budgets. And the things I wanted to emphasize that Biden is going to try to implement on the policy side, not only are happening at the state level, but he's also going to try through Medicaid and the other issues I raised to address these problems at the state level, so that there isn't such a major crunch and that states find themselves knocking people off the Medicaid rolls or reducing reimbursement to mental health providers. So, next slide. I just wanted to mention that, again, Biden, I think, is going to come out of the gate very, very fast on mental health and healthcare policy. We are going to be working very closely to pick up as much intelligence once a lot of these appointments are made, to reach out to those contacts. Gray Otis and I are going to be developing a white paper that will highlight our positions, especially on our Medicare provider recognition bill, but on the other areas that Biden has emphasized related to workforce, mental health parity, the opioid addiction, that we will also weigh in on. So we'll have to really roll up our sleeves and get to work and try to really make a dent during this transition period, to be influential and to be front and center and at the table in all of these discussions related to mental health policy that Biden has emphasized during his campaign and during the recent debates. I also just wanted to highlight that thanks to all of these policies that Biden hopes to implement, that it is going to give us multiple avenues and multiple legislative mechanisms to attach our Medicare bill and other related things that we want to do in Congress on mental health policy. We do have our standalone bill, but often we look for opportunities where legislators are packaging several bills, whether they're healthcare related or mental health related. There may be some really neat opportunities for us because of the comprehensive policy proposals that Biden has laid out to look for various avenues and how we get our Medicare bill, passed, in 2021. With that, I'll be glad to answer, any questions.